Josh Rubin from East West Healing Performance. Today I want to talk about the obliques. Now at the end of this video, stay tuned. We're going to show you actually how to work the obliques, trunk on pelvis, pelvis on trunk, where the upper extremities are closed chain, lower extremities are open chain, or the lower extremities are closed chain, upper extremities are open chain, or what you can call a lower abdominal exercise for the obliques, or more of an upper abdominal exercise for the obliques. As well as I'm going to show you actually how to create an integration of the obliques in regards to open and closed chain, as well as how to isolate the lower, or we should say the obliques below the belly button and the obliques above the belly button. So this YouTube's kind of for the practitioner as well as for the lay factor. If you don't want to know all the anatomy, fast forward to the end to learn some of these exercises. If not, listen to this. The picture at the beginnings, I couldn't really get it to show well, so I'm going to show you the picture, talk about the obliques as fast as I can in regards to anatomy, so you can understand that the internal obliques and the external obliques actually have three different fibers to them. Now, if we look at a picture here, you have the external oblique on this side and the internal oblique on the other side, EO and IO. So you can see the three different fibers at the top. At the top here, you have A, B, C. And then on the other side, right, you have C, B, A. It's different. And the A fibers of the external oblique go with the C fibers of the internal oblique. The B fibers of the external oblique go with the B fibers of the internal oblique. And the C fibers of the external oblique go with the small a fibers on this side with the internal oblique. That's how they work. They work as a team. Now, the external oblique actually originates on the upper fibers, ribs 5 and 6. Here, 7, 8, 9, and then 10, 11, 12. That's where they originate. So 5, 6, 7, 8, 9, 10, 11, 12. And they actually, fan down to attach to the inguinal ligament in the iliac crest and the pubis. Two of them actually attach, I should say one on this side and then two across the pubic crest on the other side. That's why, or how they create a contralateral rotation. Then you have the internal oblique, as I said, on this side. The internal oblique basically goes from the iliac crest to the last 4 ribs. So it comes up like that, where the external oblique actually comes down like that. So the internal obliques go up, external obliques go down like pockets. That's the difference. So you have these three different fibers of the internal oblique and the external oblique. So if you look at the different fibers as best as you can see, and once again I'll reiterate, you have the A go with the C, the B go with the B fibers, and then these C fibers go with these A fibers. You have A, B, C, and this side it goes A, B, C. So take note of that. So the A and C fibers, or we should say the external oblique A fibers, the internal oblique C fibers, actually compress and rotate the viscera, especially the spleen, the liver, and the stomach. The B fibers are both middle fibers of the internal external oblique, actually create a positive torsion and flexion of the trunk or the pelvis, depending which one you're working. In the C and A fibers, so we should say these lower fibers of the external and internal oblique, actually create a side bending of the trunk and a retroversion, or what we call a posterior rotation of the pelvis. So that's kind of your anatomy of the pelvis, or I should say the anatomy of the internal oblique and the external oblique on how they work on the pelvis. Now, for a lot of you, it might be confusing. The bottom line is you have your upper fibers that work together with both, because you have external oblique fibers, internal oblique fibers, right? They basically crisscross. Internal oblique are ipsilateral, external oblique are contralateral because they cross over the pubis and attach to the inguinal ligament in the iliac crest. So when you're looking at these, you have to train both. You can't. It's hard to just isolate the external oblique, because if you're using the external oblique, you have to use the internal oblique. So you'll see in the video that you can actually kind of isolate the external obliques in positive torsion, trunk on pelvis and pelvis on trunk. You can isolate the internal obliques, pelvis on trunk and trunk on pelvis, and then integrate them open and closed chain. So hopefully this wasn't too confusing. It's really to give you the whys behind what you're doing, so you understand that you can actually work, or the type of people you're working with, you might need to actually focus on the upper, right, more of the upper trying to get this to look right. The upper fibers of the external obliques depends who you're working with, along with the middle fibers, or depending who you're working with, because they have a severe anterior rotation, hernias, visceroptosis, you might want to work on the lower fibers of the external oblique and the internal oblique, as well as the middle fibers, to create a retroversion of the pelvis, on and on and on. So anatomy is super important, because if you understand the anatomy and what you're doing, when it comes to actually doing an exercise with your client and giving them the right exercise, you can actually give them the greatest exercise prescription to actually bring them to normalcy, prevent pain, prevent injury, on and on and on. So here we go. Let's go into the gym. Okay, now that we've gone over where the obliques are, now we're going to show you actually how to work the different fibers of the obliques, or obliques below the belly button, basically the middle and lower fibers of the obliques, in what we call positive torsion, or pelvis on trunk. The upper body is actually fixed. So arms above the head, elbows bent above the shoulders, head neutral, eyes always looking at belly button at all times to keep the spine neutral. Legs are up, crossing the legs. The bottom leg, you're going to push straight up to the ceiling. It's hard to see because of the video, but this knee is going straight up, and she's using the infra-obliques, or internal obliques, to drive her pelvis towards the ceiling. You'll do it on both sides. We're just showing you one side for the purpose of the video. To work the external obliques below the belly button, right? The lower fibers of the external obliques and positive torsion, pelvis on trunk. You basically take that same knee and you drive it across the body. So not straight up, but across the body. So now she's using these external obliques to rotate her body that way, or positive torsion, which is a little bit different. So that's how you work the, we could call them sub, infra, obliques below the belly button, positive torsion, trunk on pelvis. Now to work the upper obliques in positive torsion, what we call trunk on pelvis, not pelvis on trunk. Now the lower extremities are fixed. The lower extremities are fixed, keeping the toes up. That creates basically a connection from the fascial chain all the way up to the pelvis to lock the pelvis to keep the lower extremities fixed. Now you're working everything above the belly button, or what we call supra-umbilical obliques in positive torsion. To do the internal oblique, you're going to come up and do more of a lateral flexion to the same side. You'll do both sides. Okay, it's not across the body. It's a positive torsion for the internal oblique above the belly button. Now to work the external oblique above the belly button in positive torsion, or trunk on pelvis, cross one arm across the shoulder, the other arm comes across the body, and you're actually coming up and reaching across the body. This will actually pump, depending what side you're doing, the liver and the spleen, or the apex of the colon on the right and left side. So right now she's actually pumping the apex of the colon, what we call large intestine, on the right side, as well as the liver. Now if she does the other side, external oblique, positive torsion, trunk on pelvis, she's pumping her spleen and left flexure of the large intestine. So you notice how she's not coming straight up, she's just rotating and reaching across the body. So that would be the external oblique, positive torsion, trunk on pelvis. Now you can actually work them integrated or on the side. When you're working the lower obliques, or everything below the belly button, you're actually going to have the arm above the head, fix this point right here in front of the chest. You want to use the arms to create a fixed point, eyes always looking at belly button. She's going to keep the knees together. If you have to, put a piece of paper between here, a ball, a foam roller. You want to keep the knees together. If you don't, you're going to activate the glutes, and you're isolating everything, or the obliques below the belly button. So she's going to lift everything off the mat, straight up without rotating, and then down. That's how you work the sub-umbilical oblique complex. You're integrating them, keeping the knees together, pushing off. So this is closed chain, open chain. Now to work everything above the belly button obliques, she's basically going to keep the top leg straight, bottom knee bent. Now she's going to take her arms away. You need support for this. Person can come in, lock their foot over your foot, hand over the greater trochanter and just on the ankle. Now she's going to come straight up, working the obliques above the belly button, external and internal. you're creating a base of support in the lower extremity, which is closed chain, and she's moving the obliques above the belly button open chain. Obviously doing both sides. Keeping the eyes always looking at the belly button. Now she can integrate this, okay, what we call a complete open chain oblique complex exercise, or we call a long hinge. She can actually integrate them and go complete open chain. So now the legs and the arms move. It's a lot harder, keeping the knees together. If you need to use support to start, you can, or work in a smaller range, of course, working both sides. This is a progression. This is not meant to be started with. You want to isolate, then integrate. As she gets stronger, she can pull her arm away. Do both sides. Now, once we did an open chain, as well, you can do a complete closed chain. Now, this depends who you the person, the type of job they have, but you can do it from the elbow or from the hand, always making sure the body's in neutral alignment, head's neutral, eyes at belly button. She put her hand on her hip, she's going to drop down slightly and come up. This is actually working the obliques, completely closed chain. Now a lot of people are going to say, oh, I do this, I do that. Well, this is a progression. This is completely closed chain. So with people with injuries, this is actually quite tough.